Welcome to Family Health Today, Arkansas's only weekly in-depth look at the medical and health issues that affect you and your family. Brought to you by Jones Television, in cooperation with our sponsors, Northwest Arkansas Heart and Vascular Center and the Arkansas Democrat-Gazette.
Welcome back to Family Health Today. I'm Deborah Singer. Acupuncture has been around for centuries in Eastern culture, but it's still a relatively new procedure for many of us here in the West. While inserting needles into your body may make you cringe, especially if you have a fear of them, the practice is actually painless and can help treat a variety of ailments. Here to tell us more about this alternative medical practice is Dr. Lisa Fogel, a licensed acupuncturist from Fayetteville Acupuncture and Chiropractic. Dr. Fogel, thanks so much for being on our show today.
Thank you very much for having me.
What I want to begin with is kind of talking about the differences between the Western approach to medicine and the Eastern approach. There's a lot of differences in philosophically in approaching treatment.
Of course, yes. Generally speaking, Western medicine is very quantitative. So they're looking at numbers. They're doing tests. If people's numbers are within normal limits, then they don't perceive a problem, or there's no treatment protocol for the problem. The patient, however, may be feeling absolutely miserable, even though all the tests are normal, and that's when Eastern medicine comes in. It's very qualitative. So how are the systems within the person functioning? How is the person functioning in the world? Also, you're looking at bringing more balance to the person, whereas Western medicine oftentimes will suppress symptoms. Mm-hmm. Western medicine, of course, is ideal and miraculous for emergency medicine, for many things, but Eastern is good for prevention, building up immunity, building the immune system, and maintaining health and bringing a person again back into balance, eliminating troublesome symptoms like maybe headaches or digestive problems or pain.
Right. Tell us about acupuncture. What exactly is this?
Well, it's like you said, it's the insertion of tiny hair-thin needles into specific sites on the body. These sites were mapped out thousands of years ago as acupuncture points. Some of them are obvious. We all know this is, I have a headache, or people with achy shoulders will go like this, or for low back pain, they'll maybe go like this. These are all acupuncture points. Mm-hmm. This point is, for headaches, it's called head tied in knots, stomach 8. So it's for people that maybe have headaches because they're thinking all the time. Their thoughts are going in circular motion.
Mm-hmm. Tell us, where did the practice of acupuncture begin? A little history of, about this.
Sure. It originated in China, and it's practiced all over Asia. Goes back to Taoist philosophy and Taoist thought before written history, but there have been bronze needles found dating back to about 1000 BC in some of the archaeological sites. One of the main classical texts we still use is called the Neijing, and that was written about 200 or 300 BC. And it's been used consistently since then to treat millions of people.
Now, what is 5-element acupuncture?
Again, that goes back to Taoist philosophy. There are, within acupuncture, different philosophies or schools of thought, schools of treating people. 5-element looks at people through the lens of the 5 elements. The greater world the energy moves through the elements and within people as well, the elements being fire, earth, metal, water, and wood. And it deals more with psychospiritual issues and emotional issues, looks at the person's constitutional element and tries to find the root of the pathology through that element, mm-hmm. and treat it on the element as well.
Now, I understand there's also a connection between acupuncture and endorphins. Tell me about the connection there and just the role that endorphins play in a person's health.
Sure. Endorphins are natural painkillers. They're produced by the body under stress or when there is pain. And some of the effects of acupuncture are measurable by Western standards. So it does increase the release of endorphins to moderate pain, affects neurotransmitters as well, and immune system cells too.
Who is the ideal acupuncture patient? Tell me a little bit about kind of the most, common ailments that someone may be experiencing where they're like, I need to check out acupuncture and see if I can get get this stuff fixed?
Generally, most of my patients are either people who have ongoing chronic health problems that haven't been resolved by conventional methods, and they're desperate enough to try something new, or sometimes it's a healthy person who's been told, there's nothing wrong and the only recourse is maybe surgery or drugs, and before trying that, they want to try and see if they can resolve it without those drastic methods.
Mm-hmm. Tell us a little bit about the different types of medical conditions. You've mentioned some of them, but I also understand there's acupuncture is used to help women with fertility problems, to treat breast cancer, side effects to treatments, that kind of thing. How is acupuncture used in those types of scenarios and some other conditions that it can be a specialty for?
Okay. Well, it can be used on its own. It also can be used adjunctively with Western medicine. So that's generally called integrative or complementary medicine because you're using both. With fertility, you can treat a woman to make her body optimal to conceive and to carry a baby, but you can also do it in conjunction with artificial reproductive technology, so IUIs or IVF. With cancer patients, a lot of the treatments are very hard on the body, so acupuncture can help relieve some of the nausea and fatigue of chemotherapy.
Mm-hmm. Can you tell me a little more specifically, if I were to walk in and let's say I was going through chemotherapy and I needed acupuncture, how exactly would you treat me, using the method? If you could kind of walk me through what that experience would be if I was in your office actually going through it.
You would come in, and on the first appointment we would do a detailed health history. And I would look at your constitutional element, and that would be relevant, and I would also do what's called 8 principle diagnosis. So is the person too hot or too cold? Are they too damp or too dry? Do they have too much of something or not enough? And is the problem interior or exterior? Exterior being bacterial or viral. And 2 tools in Chinese medicine are pulse diagnosis and tongue diagnosis. So I'd feel your pulses. Are they strong or weak? What's the rate? I would look at your tongue. Is it very pale, very red, purplish? And I would take all this information and select acupuncture points. With chemo, you would probably want to help, again, relieve nausea, relieve fatigue, whatever specific symptoms you are having, and build the body up again.
Mm-hmm. Tell me, what kind of training does an acupuncturist need to go through in order to become licensed to practice, especially here in the state of Arkansas?
Yeah, it does vary state to state. In Arkansas, you have to have a bachelor's degree, then graduate from an accredited acupuncture school, which are generally 3 or 4 years. You have to pass the National Certification Commission for Acupuncture and Oriental Medicine's herbal exam and acupuncture exam. You have to be certified in clean needle technique and have 2 letters of recommendation.
Those are obviously important to have. Now, yes. Tell me, do you think that the U.S. has become more accepting of acupuncture? Do we still see a lot of skepticism or people questioning the practice?
Both. It's definitely more open on, in a lot of the major cities there are integrated hospitals, integrated clinics, but they say that half of people have tried some form of complementary medicine at this point in the United States. I think people are, it's been on Dr. Oz, it's been on Oprah, they've featured it on TV and in kind of mainstream TV shows, and definitely I think it's only going to grow.
Is there anyone out there who acupuncture, it may not be suited for them? Safety concerns. You did mention sterilization of needles and that kind of thing. Are there any kind of concerns that people should have and maybe think, this isn't for them?
Well, people should be evaluated by a medical doctor if they have serious, acute symptoms. All acupuncturists, again, are trained in clean needle technique. Anyone who's licensed is going to use only single-use disposable needles, so that's not an issue. I think that some people are afraid of infection. People, obviously, with compromised immune systems like chemo patients, AIDS, hepatitis, diabetes, you're going to want to be extra careful not to expose them to infection in any way. Pregnant women, there are certain points that are contraindicated, and somebody who's very weak, you might want to use less points than somebody who's very robust. but most people can benefit from acupuncture.
All right. Well, Lisa, thank you so much for being on our show. It definitely helped to kind of learn more about this practice, especially for people out there who don't know too much about it or have misconceptions. So
Thank you so much for having me.
Yeah, thank you. For more information on acupuncture, Eastern medicine, and the services Dr. Fogel can provide, visit www.fayettevilleacupuncture.net or www.nsha2.com.